Should I do Q&A at the end?
Yes. Yes,
And
we will.
it's 1 hour.
Yes.
So I should probably be a little bit shorter than that.
Yeah, I guess. So you probably speak for 35 minutes or
Okay.
40 minutes, and then we have the Q&A at the end.
Okay. You are in Nigeria now?
Yes.
How hot?
Yes, I am.
How many degrees?
It's a bit cool today because we're in the rainy season. So it's a bit cool. Should be in the late 20s today because of the rain.
I mean, Sweden, it's midsummer here, but it can be quite cold.
Oh,
Very
okay.
sort of between, like 15 to 30. It can be very sort of wide range of temperatures, depending on
Yeah.
where we get the low pressures from, usually from the Atlantic, and it's usually colder.
Okay, the cold front from the Atlantic.
Yeah, and warmer from Southern Europe.
Okay. I think we have just 1 more minute left. So, okay. So, Pierre, if you could take down your presentation, because I'm going to put mine up first before you put yours up.
Then I
Stop
stop
sharing.
sharing.
Yep.
Stop share, yes.
Okay, so I think we're in a good place to start. It's 4 p.m. in Nigeria, and I believe it's 5 p.m. in Sweden, right? It's an
Yes.
hour. Great. So hello, everyone, wherever you're joining us from. It's either a good morning or a good afternoon or a good evening. And this is the July webinar series from the Center for Translation and Implementation Research of Ivan Research Institute, Nigeria. And today we have a very special guest in our midst, and I will be talking about him briefly but shortly. So to speak to us today, as we all know, and that's the reason why most of us are here, is Professor Pierre Nelson. And just want to say a few things about him, and then he'll tell us a few more things about himself. So Professor Pierre Nelson is a distinguished Swedish professor of implementation science at the Linköping University. He's also a visiting professor at Halmstad University. He has his research focus on research to practice gaps, and he has a lot of research in the area of health services research, where he has a number of publications. But I think what is even more interesting is that he's an all-rounder. He's an author who has great interest in rock music, and he has written several books about many musicians and many artists in the field, such as David Bowie, Iggy Pop, and Prince. And so without much delay, I'd like to invite Pierre to go ahead and give us this wonderful lecture that everyone has been waiting for. Thank you, Pierre. We're happy to have you today.
Thank you very much for the introduction and my various interests. So now I should go for the share.
Your screen. Yeah, you can share.
And then we have this one. Yeah, thank you very much for the invitation. This is the first time I've spoken for or with African implementation researchers, but I do think that this field has become very international, because I've spent time last 3-4 years in Hong Kong, for example, and it's very sort of definitely on the upward. Often with the policies, governmental policies that need to be implemented, and implementation research seems to be filling a need. So I will talk a bit about introducing the field, but then the focus is on these TMFs, theories, models, and frameworks. So my background, I'm an economist once upon a time, and I was a consultant in the work environment, and actually implementation is sort of work environment issues, working conditions are quite relevant for implementation issues, because we see in healthcare that working conditions are quite tough, and implementation of new practices often meet resistance, which I think is often quite understandable. And various things, injury prevention was my field of when I did my thesis. Implementation research for now, it's 16 years, so it's actually been going on for quite some time. And Halmstad University, we do a lot of research these days on AI implementation. It's a very hot topic. So what I will talk about first is what is implementation and implementation science. And then go into this taxonomy, process models, determinant frameworks, classic and implementation theories, evaluation frameworks. So these are 4 or 5 categories, which I specified in a paper, I think it was 2015. And this seems like these labels are still the ones used. And then some wrapping up. And I will try to meet the deadline so it's like 40 minutes, and then discussions and questions. So what is implementation then, and implementation science? If we look at the word implere, which implementation comes from, it means fill or fill up or complete, and it's usually how implementation has been viewed as something you do sort of towards the end, although I think these days we view implementation as a process, so it's not sort of a step with a start and a finish. It actually is something ongoing. And we often use these other words meaning approximately the same. When you apply something, you execute, etc. And this is, of course, definitely not new. So many things have been implemented over time, and I think the original policy implementation research was the most sort of most commonly practiced implementation research in the 70s, and that was usually governmental initiatives, policies, reforms that were being investigated. In more recent years, I would say 10, 15, 20 years, the focus has been more on evidence-based practices, or often focus on healthcare. So there are many different terms, different labels, and I think it's kind of futile to try to distinguish these because they are very much overlapping. And I think it's sort of not so important what you label, because there might be different labels mean for the same type of research. So I think it's sort of waste of effort to try to distinguish these. It's simply implementation research. Some call it knowledge translation, etc. So what is implementation science? It was defined the first time, and I would say also the term implementation science came up to 2006. And I talked with Brian Mittman, who was one of the two who came up with this journal, Implementation Science, but also this label for this field, that they wanted to use the term science because it could easily be called implementation research, which is often also used. But implementation science to make it sound more, I guess, more natural sciences, more exact science, although I don't think it really is that exact. I mean, so what is the definition here? It's the scientific study of methods, and methods we would today usually call strategies. For example, training or financial incentive courses, strategies to promote or support the uptake of research findings and other evidence-based practices into routine practice. So the definition of the field takes for granted that there are strategies are needed for to succeed at implementation, uptake, implementation, adoption. All these terms require some sort of strategies, and oftentimes these strategies are some sort of training or supervision to support the implementation. And how does this differ from sort of typical or common health research? Well, a key difference is that we don't look at, the focus is not on the health impact, the focus is on what affects, influences the uptake. And this can also be expressed like this, that the focus is not only, or I mean, it can be, we can still do intervention studies, but in implementation science, the emphasis is on the provider, the healthcare practitioners, organization and policy levels of healthcare. So there's a distinction between this type of research and clinical research. And broadly speaking, you could say there are two types of studies. We call them, there are different terms, but diagnostic analysis of barriers and facilitators to know what influences implementation. Based on that, the idea is that we should develop and evaluate strategies that could overcome the barriers and harness facilitators. So these are the two basic key types of studies, but there are also many other studies. For example, looking at fidelity, is what we implement the same as described in research? And also cost effectiveness studies. So there are more studies than these two types, but I would say that these are the majority of studies look at one or both of these aspects. And trying to explain what the role of implementation science is, you can look at this picture, and we have to the far left what is being implemented, often called implementation object, although it might not be an object, it's more commonly a practice, a routine, a way of working. And before implementation science, we looked at the patient and population to the far right. But the recognition was that we also needed to look at the middle, the link in between here, ascertain that, well, to understand if something did not benefit patients or populations as expected, it might not be the intervention or treatment that was so bad. It might have been a poor implementation. So you could see that implementation science or the implementation is a link between what we implement and its ultimate effects. And there's often this talk about this gap between practice and research. And I think probably too often it's viewed as practitioners not taking up or adopting research at the rate that researchers might think is warranted. But I would also say that it's equally how this that equally dependent on how this research is conducted, because RCTs and other very controlled studies might not be that easy to translate into routine practice. And oftentimes in research, there is extra additional support to make the intervention work in the research. But this could mean that it's very difficult to scale up in routine practice because there might not be the same resources and support. So I think the gap here is both, you can sort of blame both researchers and practitioners, and there will always be a gap. But it's become sort of a metaphor for in implementation science, that this is the science that can bridging the gap or make it more narrow. And what we implement, we refer to as implementation objects, or they have different names, evidence-based interventions or evidence-based practices. And there are usually a treatment or intervention or a routine program policies for which there is empirical evidence for its effects, that it's effective. But this is not always the case, because we also do studies where we test the intervention effectiveness at the same time as the implementability of this intervention. So there is not always evidence for the study objects in implementation science. AI, it might be a different case. It might not be the same evidence as when we talk about patient interventions. So the implementation object can be many different things with more or less evidence for its effectiveness. And then on to this taxonomy. And we first have to look at these terms, what they stand for in implementation science. And when we talk about theories here, it's usually with understanding that there is some predictive capacity, sort of A leads to B, B leads to C, causal mechanism. Whereas models are usually used in implementation science to describe and guide the process of translating research into practice. So models are more for the practice of implementing something. And frameworks are somewhat similar to theories. And I will show a picture which I think we skipped that. So these are theories. A number of factors influence other factors, which then influencing the outcomes. Whereas frameworks, and for example, these determinant frameworks, they have sort of actually used some of the theories and compressed them, sort of instead of having causal mechanism, they just line up a number of determinants that have been found or are believed to influence outcomes. So this is the taxonomy I came up with. And there was actually quite a lot of discussions with the editors at the Implementation Science before everybody was content, because there were many people who themselves are behind some of these theories and models and frameworks, and they were very meticulous about how they were depicted in this paper and how they were classified. But let's start. So there are three overarching aims. One, the first is to describe and or guide the process, and this is more implementation practice. And then in the middle, we have the more research aim of understanding and or explaining what influences implementation outcomes. And the third overarching aim is evaluating implementation. And these three aims can be are connected with 5 different types, which I will go through. Yes, when to use this, and I think I addressed that. But process models, that is to support the process of implementing something. And I will show some examples, and you will see that they really are sort of, you could call them checklists for what you should consider when implementing something. And the determinant frameworks, they are to identify barriers and facilitators for the diagnostic analysis. And then these classic theories and implementation theories, they are more relevant when we, based on knowledge about the barriers and facilitators, want to develop strategies to overcome them or to address them, and to support implementation and or to analyze why and how change occurred. And evaluation frameworks to evaluate the results of implementation efforts, obviously. So process models, they often look like this, sort of describing a process. And this is a popular one, knowledge to action, an early one in the field, starting from knowledge creation, and then going these different stages until knowledge is implemented. Another one, or maybe a bit almost overworked, also shows a number of steps in the process, from selecting sources of research evidence, so sort of from knowledge to practice. So that's the process models. The determinant frameworks. Here's an example, theoretical domains framework, one of the most widely used by Susan Mickey and colleagues from England. And it's based on a large number of behavior change theories. And it sort of compressed them into, I think it's 14 different domains. And it's from psychology, most of these theories. So you can see that from how these the content of these domains, I think it does go beyond the individual with social influences and environmental context and resources, but it has quite a lot of emphasis on individuals, their skills, knowledge, etc. So that's often used, and we classify to see where are the key barriers, are they in knowledge or skills, etc., and what are the facilitators that could be harnessed. And here is, I think we show this instead. This is probably the most used determinant framework, consolidated framework for implementation research by Laura Damschroeder and colleagues, also quite early. And this talks about, like the previous one, a number of domains: inner setting, outer setting, intervention characteristics, and characteristics of individuals. It also talks about the process. So this essentially conveys that implementation success will depend on a combination of these different factors or domains. Meaning that even if individuals, for example, have self-efficacy, knowledge, etc., that is no guarantee for successful implementation, because there might be other restrictions or barriers. And I think that's quite important. It's difficult, or rather actually impossible, to identify individual success factors, because it's usually a combination of factors. And this is my own sort of synthesis of these number of different determinant frameworks, because they all end up looking quite similar, talking about what we implement. It has different characteristics. It might be very complex. It could be more compatible with existing practice, etc. So it has characteristics which could be very important for the implementation. And we have the strategies to the left. And we have the individuals, adopters, users, practitioners, and we have context, which is something I think implementation science struggles a bit with. We recognize that not everything is at the individual level. There is also a working environment, a culture, a leadership, etc. All these different aspects, which many times can be very important, but probably more difficult to capture in research than the adopters' attitudes, motivation, knowledge, etc. And you could add patients to this. Patients also have attitudes, and values, norms, preferences that influence implementation. Some of these determinant frameworks, they include that in the context, for example, because it's less, I guess context is what might be more difficult to change or radically modify. And here's another determinant framework: exploration, preparation, implementation, and sustainment. But this actually combines determinant frameworks with these different factors: outer context, inner context, innovation factors, the characteristics of what we implement, and bridging factors. It combines those determinants with 4 phases. So you could say that it combines determinant framework characteristics with process models features, because the determinants might differ during these stages. Something that is resisted initially could be more accepted later on, or vice versa. So I think it has a more takes into account that implementation is a dynamic process, and determinants might change over time. And then we have what I call the classic theories and implementation theories. And classic theories are other theories from other fields, existing theories, and oftentimes from psychology. And yes, a few examples widely used in many fields. Here you can see that it's a theory because it shows the causal mechanisms of behavior change. This is also used in implementation science because the focus is often on individuals' behaviors. Because, yeah, and here is another social cognitive theory, widely used, very important, I think, because it shows, excuse me, the importance of self-efficacy, having the confidence in the skills, in the practice that is implemented, and having the confidence that you can execute it well is important. And I guess training is usually a strategy to achieve that. So those were two theories, but there are also a whole range of other theories and concepts, which are not as commonly used in implementation science. Learning, for example, you can view implementation in terms of learning. Leadership, obviously very important. Culture, I think, is extremely important. It could be professional, the culture within different professions. It could be the culture within a hospital. But it's sort of a collective influence on implementation. And I think those influences might be more difficult to capture. And then we have implementation theories. That was my name for the label for a few theories developed within the field. And this is a common one, normalization process theory. And it sort of emphasizes that its sort of unique selling point is that it focuses on what practitioners do, rather than what they say they do. So it sort of sets itself apart from theories from, I guess, with more from a psychology background. And here's another one, also very popular, capability, COMB. It essentially says that a behavior depends on three factors: capability, the ability to be able to execute it, the motivation, the willingness to do it, and opportunity, or the restrictions, context, everything aside from motivation and capability. And evaluation frameworks, there aren't so many. Re-aim, quite popular from public health, with the idea that not only effectiveness of an intervention is relevant, important to study, but also its reach, because a small effect, but for a huge population that is reached, could be very important. So I think it's broadened evaluations of interventions to also capture that, and the extent to which this intervention is adopted and delivered. And implementation here is, I would say, it's more fidelity, that is the intervention delivered properly as prescribed in research. And maintenance is the sustainability of the intervention. And something the field also struggle a bit with is the outcomes, because it's not as obvious as in patient or clinical research, where you usually have a health-related outcome. In implementation science, it's not always that clear what is the outcome, but those 8 types of outcomes to the left are the ones we usually try to measure, but usually it's very difficult to measure all of them. But some are measured more, I would say, more qualitative through interviews. We usually look at acceptability, appropriateness, and feasibility, because those 3 are usually seen as predictors of implementation, successful implementation. So they are rather a bit like determinants. So I would say there is some overlap outcomes and some determinants. But then adoption would be a very, or slash uptake. What is commonly the goal to evaluate. But I think increasingly we recognize that cost is also another factor. You can implement many things if there is unlimited resources, but that's hardly ever the case. So also looking at what were the costs of implementing something in research, and analyzing to what extent makes this the implementation, can it be scaled? Fidelity is about the extent to which what is implemented is the same as in research, described in research. Has it fidelity to the description? Because usually we talk about fidelity and adaptation, because usually practices are adapted to the circumstances, the context. And then penetration and sustainability are 2 factors having to do with the integration of an intervention into routine practice and its long-term implementation or embeddedness in the practice. So I think I've gone through them all. So these are the 5 categories and the 3 overarching aims. And I think it's also important to say, emphasize that all of these process models, determinant frameworks, classic theories, and implementation theories can also be used for evaluation purposes. So when I talk about evaluation frameworks here, it's only the ones that were specifically developed for evaluation purposes. But you could use determinant frameworks and all the theories and models also for evaluation purposes. And reprise, the process models is more for the implementation practice, sort of checklists. Consider these activities when implementing a new practice. And determinant frameworks key use to identify the barriers, facilitators, what is influencing the implementation, because this might you have to address. And classic and implementation theories are more relevant when developing strategies based on these determinants, and or to analyze how and why change occurs or not. And it's actually quite similar to logic models, which some might are doing, is that you specify, you make assumptions explicit how you think implementation or a strategy is going to work, because that makes it more feasible to analyze what needs to be improved, what could be better, what were the key factors in a successful implementation, and evaluation frameworks to evaluate the results. So that's it. So now I can I stop the sharing? Can you do that?
No, you can leave your slides on so that if we get any questions around any of the slides, but then you can go back to it. But thank you so much. Very, very interesting. As you know, we have a mix of the audience here. We have core implementation scientists, a lot of them on the meeting now. We have early career researchers in implementation science. And then we have people who are just curious to know what implementation science is. So we have a couple of questions in the Q&A. And I will start with the question from Ether. So Ether says, intervention is a strategy, but can it be said to be an implementation research? Does implementation research fit within broad methods paradigm of quantitative, qualitative, or mixed methods?
I would say that implementation research uses equally, or maybe even more, qualitative and quantitative. I think ideally outcomes would be quantitative, but it's not always possible to get data. But I think determinants, we often do qualitative research, because you have to be sort of explorative. If you do quantitative, you can have a survey, but then that requires that you need to know all the potential barriers and facilitators. And I think you might miss some. So I think that sort of speaks in favor of qualitative research to understand why something, it's difficult to implement, barriers and facilitators. But it's not, even though it's called the science, it's not more quantitative than, I call it social science. I mean, social science, where everything is sort of interconnected, is a more correct, accurate description of implementation research, I think.
Okay, so you think it falls into the social sciences more than, okay.
Yeah, I think so. I guess it started, and I have other presentation on that, the history. It started in the wake of evidence-based movement, and of course that was medicine with the RCT ideals, and they sort of, I guess, imported those sort of perspectives, views on research. So I think it started out as having those ambitions, but it has definitely grown in different directions. And is more, I guess, a bit more like policy implementation research, which was political science, but you could also view it in terms of social science.
Okay, thank you. So Stanley is responding to one of your slides. where you had the implementation, the slide where you had the implementation outcome, patient outcome. So he's saying, is patient or service outcome different from clinical outcome? So the slide where you had the 3 bars.
I think this
one.
Yeah,
Yes,
I guess.
yes. So he's asking the difference.
Yes, and I
So
guess
clinical outcome. So which is clinical outcome, or is clinical outcome different? That's what he is asking. Is clinical outcome similar to patient outcome?
Yeah. I would say this is just another label for clinical outcomes. This sort of health-related patient-level outcomes. That's
Okay.
That's accurate.
Okay. Okay. So Billy Amin is asking a question, saying, is there a limit to the number of theories, models, and frameworks that can be combined within a study?
Yeah, that's a good question. I get that sometimes. And I think we do quite a bit of combining of theories, models, and frameworks, but I guess it also depends on, they have to be sort of aligned. If they are based on very disparate, different assumptions, it might be difficult, because if you assume that, for example, behaviors are very habitual, very embedded, you might not use social cognitive theory, because that sort of assumes or depicts behavior as being influenced by motivation, attitudes, whereas a more habitual behaviors probably wouldn't be so easily influenced by that. So yes, we can combine, but you have to consider that the assumptions of the TMFs you use are not sort of clashing or widely different.
Okay. So Kazim says, could implementation research be regarded as intervention research?
Yeah, that's interesting. I guess so, because I mean, without intervention research, there would be sort of no use for implementation, because it's implementation of interventions or treatments or practices, so many different terms. But yeah, I think it's actually very similar to when we talk about process evaluations of interventions. That was intervention research, but looking at the process. And now we usually talk about that as implementation research. So, yeah, I'm not sure if it can be regarded that's for intervention researchers to decide, but I definitely think they go together and can sort of, they are important, because if you only do intervention research without considering the implementation, you're obviously missing something, because it could be the context or leadership or whatever that might be at the cause of a poor outcome. So they are closely linked together. That's I can say that anyway.
Okay. And then we have a question from Victor, who says, how can the frameworks in implementation research be applied to facilitate the implementation of a new evidence-based mental health intervention in a Nigerian healthcare setting, considering that there is a complex interplay between the intervention, the inner and outer settings, the individual, and the entire process of the implementation?
Yeah, I think the process models are tools to support benefit implementation, because I think, I mean, the alternative, I guess, is relying on common sense, something we have done before, experience, etc. And nothing wrong with that. But I think using these checklists, which describe or pinpoint a number of activities shown to be important in various implementation projects. And I think having those provides a structure. And I compare them a bit like when airline pilots use the checklist before taking off. They could probably manage without the checklist, but we are quite happy that they have these because this sort of provides the structure and sort of security. And I think in implementation, you could support implementation by using process models as a tool. A bit like PSDA, what is called these cycles in the improvement projects. So it's a tool.
Okay. So, Pierre, I'm going to have to introduce our director here at Ivan Research Institute, and he's here on the panel with us, Professor Echezona Ezanule, and he will say a couple of words. So.
Yeah.
Thank you so much. I have enjoyed your lecture. It's always interesting to see a little bit of this breakdown. And again, no matter how many years we have done this, and you can still see the people trying to understand how does this different from operations research, how does this different from all of those things, and what guides the principle of what we do. But one of the things we're trying to do at the Nigerian Implementation Science Alliance, which is really our umbrella body of people who are interested in implementation science in Nigeria and beyond in African region, is really to be able to start knowing that we have a mixed method, but to be able to start a mixed audience, but to be able to start from a very basic understanding of implementation science and all of these theories, models, and framework. So this is a fundamental to all of us. So thank you so much for joining us. I'm hoping that you will come back again for this series that we are doing. Our idea is that we do the monthly webinars every month. Then we have a quarterly week where we invite experts like you to be able to speak on different topics. Last June, we do it in June. It was people from the different institutes of the National Institute of Health. But also we have a conference in September when all of us come back together to share our things that we've done. One of the things that when Professor Nyeka was mentioning that is a large part of our audience is this population that is implementation practitioners. The implementation practitioners have really, really long experience, some of them 10 years of experience of actually implementing. And what we have noticed is that there is this big gap between these implementation practitioners and implementation scientists. So most of our work is really to bridge those gaps in a way that the implementation scientist is speaking the language the implementation practitioner understand, and the implementation practitioner understand the language of them, so that when they actually work together, because most of the time the implementation scientists do not actually implement on the ground, and you find out when there's a mixed understanding, there remains this gap that continues to exist. So thank you for helping us in our attempt to close the gap between those implementation science and practice, and we hope we'll see you back again. Thank you.
Thank you very much. Yeah, I agree that I think it's important that the implementation researchers engage with the practitioners, and we do much more co-designing strategies these days, much more emphasis on that, because you cannot sit in your ivory tower and come up with all kinds of ideas. I think this is really close to practice research. So I agree. Definitely. This needs to be reached. Yeah, I'd be happy to come back. Definitely.
Thank you.
You seem to have a wide area. I saw the number of attendees quite large. I think one of the largest groups I've presented something for.
You're
So
seeing,
you
remember, you're seeing
have
about half of them. There's another half,
Yes.
there's another number that is on YouTube. They're also watching
Yes.
this live.
okay.
So it's larger than this number, and that's the platform that we're very we really pride ourselves on this opportunity that takes it to so many people, no matter what stage of the research process they are. So you will see people who are undergraduates, graduates, post PhD, experienced professors, but they all have individual things to benefit from it. And that's why we really like this platform and the opportunity that you present to all of us. And we're really excited about I'm looking at this slide that you put in. I can't remember how many times in all the grants that I write. This slide is still one of the things that I have to put in there to be able to use it to guide myself about the outcomes that I want to be able to make sure that it's coming out and help you build back about the research you are designing. Thank you so much. And to everybody that is attending, we do hope that you could always join us on the Mondays and then on our quarter webinars. And remember, there is a special opportunity for you where we have our research in progress. So if you are designing a research protocol for proposal, we only based on grants that have been or proposals that have been submitted for grant funding. You can write out of the email that is out here, and we can provide input to your designs, especially when there are implementation science projects. And we do those things. We invite you to speak at the meetings, which we hold every Monday, 2 to 3 hours every Monday, except the first Monday when we have this webinar. In the other Mondays of the month, we have a 2 to 3 hour research in progress where you can actually bring in your research project and then you get feedback from investigators who have successfully competed and carried out implementation science projects in Africa. So thank you, everyone, and we hope, Sonia, I think before we close, you should get up the slide. We hope to see you at the conference because something big and is changing. We are going to be having one of the first training program in implementation science in Nigeria that is going to be formal, moving us from the CTAIR scholar that we have done all this with and expanding it even further for those who want to continue on that pathway. So if September 10 to 13, you will not regret the opportunity. And thank you, and hope you, Dr. Pierre, that one I don't know if you have been to Nigeria, meet you in person. Is one of the things we try to do is to bring people to Africa in a way that people who have read about your work but have never really met the people and I meet have been successful in doing that. So we look forward to an opportunity for you to visit Nigeria.
Mm-hmm. Thank you very much. I think the connection was either mine or just towards the end.
Ours. Thank you so much, Per, and thank you, everyone. If you want this recording, Per, I think you can share you would share your slides with us. We'd be happy to have them. And we have a YouTube channel where you can watch this again and again and again. And we also have past webinars. And like Professor Eche said, we have an implementation science, the largest implementation science conference in sub-Saharan Africa is in Nigeria in September. And Pierre, we're hoping that you would come. We still are inviting you. We hope you would come for the conference in September, but more importantly, to join us in our research week next year. Want you more involved with us. Thank you so much. Thank you, everyone, for joining in.
Yeah, thank you very much.
And have a nice rest of the day.
Thank you.
Yeah.
Bye-bye.
Thank you. Take care.
Thank you, Professor Nneka. Thank you for the work of putting this together all the time. I think every year, every month, it's amazing how much new ideas, new people that we engage. And hopefully that we can continue to be these multiple platforms for bridging our capacity. Thank you for the work you do.
Yes. Thank you, sir. Thank you so much. I appreciate it. Thank you, guys. Right? Do us an email. We've shared our email. Go to our YouTube channel and watch all the past webinars, including this one. Thank you for attending. See you next month. Bye-bye.